Did you know a random itch in your body could be your body's quiet alarm bell, warning you about cancer long before any pain shows up? Many older adults overlook these silent signals, thinking it's just dry skin or allergies. But if you're over 60, certain stubborn itches in very specific spots could mean something far more serious. In this video, I'm revealing 5 secret itchy spots where cancer sometimes announces itself first, sometimes months before anything else. Stay with me to learn how to spot these subtle signs, why they happen, and when to talk to your doctor. This knowledge could save your life or someone you love. No panic here, just powerful awareness. Before we begin, if you're new here, don't forget to like this video and subscribe to the channel. If you find this helpful, drop a quick comment below with your favorite affirmation like, "Listen to my body," or "Health first." And if you don't like the video, just comment 0 so I can make better content for you. Sign 1. Itching on the lower legs that just won't quit. Itching on the lower legs that just won't quit can feel like a minor nuisance, but sometimes it's a sign your body is trying to tell you something serious. When there's no rash, no dryness, or visible skin problem, persistent itching might point to an underlying issue deeper than the skin. In older adults especially, this kind of itch can be a subtle symptom of conditions like Hodgkin's lymphoma, a form of blood cancer that causes inflammation irritating the nerves beneath the skin. Ignoring such an itch could delay diagnosis and treatment. If you notice an itch that keeps coming back or worsens at night, start by paying close attention to other signs your body might be sending. Track if you feel unusually tired, if you sweat at night, or if you lose weight without trying. These clues can help your doctor figure out if something more than dry skin is going on. A practical first step is to keep a simple symptom diary. Note when the itching happens, what you were doing, and any other new changes in your health. This makes your conversations with your healthcare provider much clearer and more focused. Take Harold, for example. At 74, he struggled for months with a burning itch on his shins. No lotion or cream helped, and his skin looked perfectly normal. It wasn't until his fatigue and night sweats worsened that he sought a thorough checkup, where doctors discovered Hodgkin's lymphoma. Harold's story reminds us that when our body feels off, even in small ways, we must listen and act early. His courage to seek answers saved his life. As the saying goes, sometimes the body whispers before it shouts. Don't dismiss persistent itching or other vague symptoms as just part of aging. Early awareness and timely medical advice can make all the difference. Your health is your most precious asset. Honor it by paying attention to its quiet signals. Let's move forward. Sign 2. The phantom itch between your shoulder blades. Sometimes an itch isn't just skin deep. It can come from places inside your body that you wouldn't expect. That's exactly what happened to Linda, 69, who experienced a persistent, nagging itch deep between her shoulder blades. What made it puzzling was that there was no rash, no visible injury, and no sign of dry skin. The itch felt like it was originating from inside her body, almost like a phantom sensation. In cases like this, the itch can be a silent signal from organs nearby, hinting at problems that might not yet cause obvious symptoms. Linda's doctors eventually discovered the cause wasn't skin-related at all. A tiny tumor in her pancreas was blocking the flow of bile, causing bile salts to build up and irritate the nerves in her upper back. This irritation sent confusing itch signals to her brain, creating that phantom itch sensation. What makes this sign so important is that it can appear long before digestive symptoms, pain, or other more obvious warning signs develop. It's like your body's way of sending a secret message to pay attention. If you find yourself dealing with an itch between your shoulder blades that won't respond to creams or lotions, take note of any accompanying symptoms. Feeling unusually tired, experiencing changes in urine color, especially darker shades, or any unexplained discomfort should prompt a medical checkup. A symptom diary can help track these changes. When you share this detailed information with your healthcare provider, it makes it easier for them to investigate possible internal causes, rather than focusing only on your skin. As the poet Rumi once said, "The wound is the place where the light enters you." Sometimes these strange sensations that bother us are actually the body's way of drawing our attention to deeper issues that need care. Don't brush off that stubborn itch as just a minor irritation. Your body's subtle messages matter, and early detection can make a life-saving difference. Listen carefully. You may be hearing your body's whisper before it becomes a shout. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating content to inform and inspire you. Now let's move forward. Sign 3, an itchy scalp that won't stop. An itch on the scalp is something most people experience now and then, but when it becomes relentless and unresponsive to usual remedies, it can signal something more serious. Henry, 72, faced this exact challenge. Despite trying every shampoo, oil, and even avoiding his favorite hat, the itching persisted. Unlike ordinary scalp dryness or dandruff, this itch moved around unpredictably and never seemed to ease. When symptoms like this linger without explanation, it's important to consider that the cause may lie deeper than the skin itself. In Henry's case, blood tests uncovered a diagnosis that was unexpected: chronic lymphocytic leukemia, CLL, a type of blood cancer affecting white blood cells. This condition can irritate nerves beneath the skin, triggering that crawling, burning sensation Henry felt on his scalp. Unlike common dry scalp or eczema, this itch is persistent, sometimes spreading to different areas, and won't respond to topical treatments. It's your body's way of signaling that something unusual is happening internally, even if other symptoms haven't yet appeared. If you or someone you love is dealing with an itch like Henry's, one that doesn't improve with usual care, pay close attention to other signs your body may be giving you. Feeling more fatigued than usual, noticing easy bruising, or experiencing frequent infections are important clues to share with your doctor. Keeping a detailed record of your symptoms, including when the itch worsens or any new signs, can help healthcare providers diagnose the issue earlier. Early detection means earlier treatment and better outcomes. There's a saying by Maya Angelou that resonates here: do the best you can until you know better. Then when you know better, do better. That relentless scalp itch was Henry's body trying to tell him something was wrong. Listening to these subtle signs and acting on them can be a crucial step in protecting your health. Don't ignore that persistent itch. It could be your body's way of asking for help before more serious symptoms appear. Let's move forward. Sign 4, the overlooked itch on the chest or breast area. An itch on the chest or breast area is often dismissed as dry skin, irritation, or even a minor allergy. But when that itch lingers day after day without relief from creams or lotions, it can be a subtle warning sign of something more serious. Ruth, 68, experienced exactly this: a stubborn itch near her breast that never seemed to go away. There was no rash, no obvious redness, just that persistent, nagging irritation that slowly began to disrupt her daily life. Many people ignore these kinds of sensations, but Ruth's awareness and willingness to seek medical advice made all the difference. Ruth's doctor discovered early inflammatory breast cancer, a rare but aggressive type that doesn't always present with the typical lump or pain you might expect. Instead, this form of cancer often begins with changes in the skin, including persistent itching, redness, swelling, or warmth in the breast area. Because these symptoms mimic less serious skin conditions, they're frequently overlooked or misdiagnosed, delaying crucial treatment. It's important to remember that breast cancer is not only a woman's disease. Men can develop it too, and they might mistake an itch or skin change for something minor like a rash or irritation. If you notice an itch in the same spot every day that resists creams or moisturizers, especially if you see swelling, warmth, or changes in skin texture nearby, it's essential to get it checked by a healthcare professional right away. Early detection dramatically increases the chances of successful treatment and can prevent the cancer from spreading. Being proactive and trusting your instincts about your body can save your life, even if the symptoms seem small or confusing. As the famous breast cancer advocate and author Audre Lorde once said, "Caring for myself is not self-indulgence, it is self-preservation." That persistent itch was Ruth's body signaling something important, and by listening closely, she took control of her health. Don't let discomfort or hesitation hold you back. When it comes to unusual, ongoing symptoms, early action is your best defense. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating content to inform and inspire you. Now let's move forward. Sign 5, the embarrassing itch that shouldn't be ignored. Itching around the anal or genital area is often brushed off as a minor annoyance or something embarrassing to talk about. Many people like Eugene, 77, assume it's just hemorrhoids or irritation from diet or hygiene. Eugene tried creams, adjusted his diet and used cold packs, but nothing eased the discomfort. What he didn't realize was that this persistent itch was a quiet warning sign from his body, one that shouldn't be ignored or dismissed simply because it feels awkward to discuss. After months of persistent symptoms, Eugene's doctor recommended a colonoscopy, which uncovered a small early-stage tumor in his anal canal. Because tumors in this area often grow slowly and symptoms can seem mild or similar to common conditions like hemorrhoids, they're easy to miss until the cancer progresses. The itching Eugene experienced was actually nerve irritation caused by the tumor's presence. This early diagnosis meant he could start treatment right away, vastly improving his prognosis and quality of life. If you experience itching in your genital or anal area that lingers, worsens, or develops into raw, burning sensations, it's crucial not to stay silent. It may feel embarrassing to bring up with your doctor, but these symptoms can indicate infections, inflammatory conditions, or even cancers that require prompt attention. Early detection is vital. When caught early, many conditions can be treated effectively, preventing serious complications and offering a better chance at recovery. As physician and author Dr. Atul Gawande reminds us, better is possible. It does not take genius, it takes diligence. Being brave enough to speak up about uncomfortable symptoms and seeking timely medical advice is one of the most important ways to care for yourself. Don't let embarrassment stand in the way of your health. Your body's signals deserve to be heard and addressed. Let's move forward. Final thoughts. Your body communicates in mysterious ways, and sometimes an itch is much more than just an itch. These subtle signals can be early warnings of serious health issues that often go unnoticed until it's too late. If any of the signs we covered sound familiar, don't brush them off or wait for them to disappear on their own. Reach out to your doctor and get checked. Early awareness means early treatment, and early treatment can save your life. Taking care of your health starts with paying attention to these quiet messages your body sends. It's easy to dismiss itching as a minor annoyance, but sometimes that itch is your body's way of asking for help. Don't ignore it, especially if it's persistent, unusual, or accompanied by other symptoms like fatigue, weight loss, or changes in your skin. If this video gave you new insights, please comment below with the number of the sign that surprised you the most. Your story could help someone else recognize their own symptoms earlier. And if you want more life-saving health tips, be sure to subscribe and hit the notification bell so you never miss an update. Remember, your health is your most valuable asset. Listen closely to what your body's telling you. It's the best way to protect yourself and live your fullest life. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned and how you plan to apply it in your life. Your thoughts truly matter to us, so don't hesitate to share. Reading your comments motivates and inspires us to keep creating content for you. If you found this video helpful, please like, subscribe, and share it with others. Your support allows us to continue providing valuable content that informs and inspires. Thank you for watching, and we can't wait to see you in the next video.